Our final shortlisted book is an in-depth analysis of the current opioid epidemic in Canada, and it's from the perspective of an addiction doctor who is working on the front lines. Politics, socioeconomic factors, and the history of science and medicine are interwoven with the voices of those people suffering from substance use disorders. This is The Age of Fentanyl, Ending the Opioid Epidemic, written by Brodie, Ramin, MD, and published by Dundurn Press.
So much about drug use is tarnished by prejudgment and ignorance. By looking deep into humanity's history with opiate use and the experiences of drug policy and drug treatment over the last century, we can get perspective on our current time and think more clearly about what is happening, why it's happening, and what will work to help save lives and move us to a better and safer world. In The Age of Fentanyl, I tell the story of the opiate epidemic from my perspective as a Canadian addiction medicine doctor working on the front lines. I wanted my readers to really see and feel what it's like to be in the center of the storm, with the goal of destigmatizing people who struggle with substance use and demystifying the interventions and treatments that we use to combat the epidemic. There are steps that can be taken to make a difference. Some can be changed with the stroke of a pen. Some will take years and a cultural shift. We've learned a lot about fighting disease in the last year. We need to put some of that knowledge to use in confronting the opiate crisis. And that's why I wrote The Age of Fentanyl, Ending the Opiate Epidemic.
Hi, my name is Faria, and I'm a Master of Public Policy student at the University of Toronto's Munk School of Global Affairs and Public Policy. I'm also one of the new executive producers for the Munk School's public policy radio show and podcast, Beyond the Headlines. I'd like to ask Dr. Brodie Ramin about his book, The Age of Fentanyl, Ending the Opioid Epidemic. Dr. Ramin, your book discusses how isolation is a circumstance that can lead to substance abuse. My question is related to this point. Given the instability and isolation that has occurred this past year due to the COVID-19 pandemic, how is this affecting opioid users, and what long-term impacts do you anticipate will be a result of this?
Thank you. Thank you for your question. I think social distancing has been a key strategy to reduce the spread of COVID. But what it has meant in practice is that since the spring of 2020, people have been using substances on their own far more, which is the most dangerous way to use toxic drugs like fentanyl. We've also reduced the density of people allowed at harm reduction services, at treatment facilities, and in residential programs. And these changes have resulted in greater barriers to accessing prevention and treatment services. As you say, these various forms of isolation have likely been big contributors to the increases in opiate use and overdose deaths that we've seen over the past year. On the other hand, addiction treatment has been able to pivot very quickly to providing virtual care, which in some ways has reduced barriers to accessing treatment. Every day we're learning new lessons about how to keep people safe and engaged in care. Thank you, first of all, to the Donner Foundation and everyone working behind the scenes on the Donner Prize. By shining a light on public policy issues, the prize helps us to engage the public in the ideas and events that shape our society, and it encourages citizens to be part of these critical conversations. Big congratulations to all my fellow nominees. I want to thank all my teachers, my mentors, my colleagues and role models who took so much time and dedication to teach me to understand the world, to understand medicine, to want to make things better for everyone. I grew up around the world and I studied and trained across Canada, so thanks to all of you. My patients have inspired me and also taught me so much about their lives, about their health, and about what they need to heal. My editors at Dundurn, my agent, Lloyd Kelly, have all been amazing. My family has been so supportive. My wife, Melissa, my children, Oliver and Beatrice.